CNA Prometric Exam 2026. Question 1. If you are walking with a resident and they fall, which of these is not an action you should take? Leave the resident on the floor and get help. Inform the nurse. Supply information for the nurse. Keep the resident from moving until you assess injuries. Leaving a fallen resident alone is unsafe. You must stay with them, protect them from further harm, and summon help while maintaining their position until they are assessed. Question 2. If you smell smoke and discover a resident smoking in his room, it is best to ignore the first incident. Call the family to deal with it. Remind him of facility policies due to safety hazards. Allow him to finish but warn him for next time. Smoking in a room is a severe fire hazard. You must immediately stop the behavior and explain the policy to ensure the safety of all residents. Question 3. A resident is supposed to have 8 ounces of juice every 2 hours. Which choice meets this requirement? 30 milliliters, 100 milliliters, 120 milliliters, 240 milliliters. 1 fluid ounce is approximately 30 ml. Therefore, 8 ounces equals 240 ml. Question 4. All of these might be used in dealing with contractures except hand roll, repositioning, bandaging, physical therapy. Bandaging is not a treatment for contractures. Physical therapy, hand rolls, and regular repositioning are standard methods to prevent or treat joint stiffening. Question 5. Hypertension is a medical term for tense muscles, high anxiety, hyperactivity, high blood pressure. Hypertension is the clinical term for blood pressure consistently above the normal range. Question 6. To minimize infection, which procedure should be used for washing the perineum of a resident with a catheter? Wash from rectum to meatus. Wash from rectum to scrotum. Wash from the meatus out. Wash with peroxide. Cleaning away from the meatus prevents the introduction of bacteria from the genital or anal areas into the urethra, reducing the risk of a UTI. Question 7. Which of these should not be part of the process for cleaning a resident's dentures? Patting the sink. Placing clean dentures on a tissue on the table. Rinsing thoroughly. Washing your hands. Placing dentures on a tissue is unsanitary and risks them being thrown away. They should be stored in a labeled, clean denture cup with water. Question 8. A resident can't find his dentures. As a NA, your responsibility is to document the loss in the medical record. Notify the family contact. Ask the resident to refrain from eating. Notify the supervising nurse. Missing items are a facility issue. Notify the nurse immediately so a search can be conducted and the loss can be documented. Question 9. According to CDC recommendations, the scrubbing portion of handwashing should take any amount of time: 20 seconds, 60 seconds, 10 seconds. The CDC recommends scrubbing hands with soap for at least 20 seconds to effectively remove pathogens. Question 10. All of these precautions should be followed when using a transfer gate belt, except rocking and pulling while the resident is seated, never using a frayed belt, not worrying about proper body mechanics, placing the belt around the waist. Proper body mechanics are essential when using a gate belt to protect both the caregiver's back and the resident's safety. Question 11. Which is an accurate method for counting respiration rate? The resident counts to 60. The nurse looks at her watch while you watch the chest. The resident counts while you watch. The nursing assistant looks at the chest and a watch at the same time. To get an accurate rate, the observer must count the rise and fall of the chest over a full 60 seconds while monitoring a watch. Question 12. The term tetraplegia is often used interchangeably with paraplegia, hemiplegia, cardioplegia, Quadriplegia. Tetraplegia and quadriplegia both refer to paralysis affecting all four limbs and the torso. Question 13. Which of these is not true when taking a blood pressure reading? BP is higher in the mornings. Sitting with feet on the floor is optimal. The resident should not talk. Lying down with feet elevated is optimal. Blood pressure is best taken while sitting or lying flat, not with feet elevated, which can affect the reading. Question 14. A resident has dizziness, faintness, BP below 90/60ths, and sweaty skin. This is hypodermia, hypoglottis, hypertension, hypotension. Hypotension, low blood pressure, presents with dizziness, cold/sweaty skin, and lightheadedness due to reduced blood flow. Question 15. Alcohol-based hand cleanser is appropriate except after walking a resident, after handling clothes, when hands have observable dirt, when soap and water are not available. Hand sanitizer is ineffective on hands that are visibly soiled with dirt, food, or body fluids. Soap and water must be used in these cases. Question 16. Which of these is not true about tympanic temperatures? Use a speculum cover. Pull on the ear pinna. Wait for the signal. Be sure the ear is free of cerumen before inserting. While it is good for the ear to be clean, you do not need to check for wax before inserting the probe. The thermometer is designed to measure the ear canal temperature. Question 17. If a clean nightshirt falls to the ground, it is best to ask the resident to use it anyway. Tell the resident to wear it until you get another. Place it on a chair. Put it in the hamper and get a clean one. Any linen that touches the floor is contaminated and must be laundered to prevent the spread of infection. Question 18. Convulsions are associated with a sprain, a seizure, a spasm, a tear. Convulsions are the physical manifestations of a seizure, involving involuntary muscle contractions. Question 19. When muscle tissues shorten and a joint becomes hard to move, it is called rupture, perforation, twitch, contracture. A contracture is the permanent stiffening of a joint caused by the shortening of muscle tissue due to disuse. Question 20. To obtain the most accurate resident weight, the nursing assistant should weigh the resident at the same time every day, 3 to 4 hours after eating, with 2 different scales, directly after a meal. Weighing at the same time, ideally in the morning after voiding and before eating, minimizes the impact of food and fluid intake. Question 21. If a patient just had a cold drink, oral temperature should be taken 15 minutes after, 3 to 5 minutes after, immediately, 75 minutes after. Consuming cold or hot liquids temporarily changes oral temperature. You must wait 15 minutes for the mouth to return to its baseline. Question 22. When a resident has MRSA, dispose of the gown and gloves in the patient's room. Continue wearing them in the hallway, in the next patient's room. PPE must be removed in the patient's room to ensure contaminated items do not touch surfaces in common areas. Question 23. Another term for decubitus ulcer is ulcerated cyst, perforation, ulcerated tumor, pressure sore. Decubitus ulcer is the medical term for a pressure sore caused by prolonged pressure on skin. Question 24. Which thermometer will provide the least accurate reading? Axillary, tympanic, oral, rectal. Axillary, armpit, temperatures are the least accurate as they measure surface temperature rather than internal body temperature. Question 25. When transferring from a wheelchair to a stationary chair, the NA should stand to the left, to the right, in front of the wheelchair, behind the wheelchair. Standing in front of the chair allows you to guide the resident and maintain control of the transfer safely. Question 26. What is considered neglectful when assisting with a shower? Assuring the resident you will help them, being patient and calm, testing water temperature, leaving the resident alone. Leaving a resident alone in the shower is a major safety risk and is considered neglect if they are not able to supervise themselves. Question 27. If a resident is suffering chest pains, you should not offer support, give water and place them downright, act calm, call for help. Giving water to someone with chest pain is unsafe, as they may require urgent cardiac procedures. Placing them in a position that causes aspiration risk is incorrect. Question 28. All of these are ways to prevent pressure sores except changing soiled sheets, changing positions, providing extra blankets, avoiding wrinkles. Extra blankets do not prevent pressure sores. In fact, they may cause overheating and moisture buildup, which increases the risk. Question 29. Which of these describes stage 4 of a decubitus ulcer? Redness, blackened crater, damage to bone, joint, or tendons, open area with redness. Stage 4 pressure ulcers involve full-thickness skin loss with extensive damage to bone, muscle, or other supporting structures. Question 30. Medical term for burping, belching, and passing gas. Fascia, familial, flatus, flank. Flatus is the medical term for gas generated in the stomach or bowels and expelled through the rectum or mouth. Question 31. Making a bed should end with adjusting height, moving call light, mitering corners, washing your hands. Hand washing is the final step in any procedure to prevent the spread of bacteria picked up while handling soiled linens. Question 32. Which of these is least likely to contribute to skin tears? Equipment, resident falls, length of hair, length of nails. Sharp nails and hitting equipment/falling are common causes of skin tears. Hair length has no impact on skin integrity. Question 33. Which of these treatments would be best to decrease swelling? Cold compression, heat compression, dry bandage pressure, moist bandages. Cold application constricts blood vessels, which helps reduce fluid accumulation and swelling in tissues. Question 34. Which is the least likely to signal impending death? Increase in appetite, labored breathing, cooled extremities, unstable blood pressure. A decrease, not an increase, in appetite is a common sign of the body shutting down as death approaches. Question 35. Head elevated with legs bent or straight is Fowler's position, Rose's position, Sims position, Trendelenburg's position. Fowler's position refers to a seated or semi-seated position, used to aid breathing and comfort. Question 36. Proper body mechanics for lifting a resident. Bending at waist, locked knees. Bending at waist, partially flexed knees. Bending at waist, unlocked knees. No bending, flexed knees, using legs. Flexing the knees and lifting with the leg muscles, while keeping the back straight, is the correct technique to avoid back injuries. Question 37. Best use of alcohol-based sanitizer is when hands are not visibly soiled, when hands are visibly soiled, when hands have blood, when helping with catheterization. Hand sanitizer is only effective on hands that do not have visible dirt or contaminants. Question 38. Which of these is incorrect in reference to wearing gloves? Peel glove away inside out. Wash hands before/after gloves. Always wear latex. Avoid letting outer layer touch skin. Some people have severe latex allergies, so nitrile or vinyl gloves are often used. Never assume latex is the only or best option. Question 39. You notice a resident is dyspneic, respiratory rate 30. What do? Do nothing. Turn up oxygen. Rest comfortably and notify nurse. Lay flat and breathe slowly. Dyspnea, difficult breathing, is a serious sign. Rest the resident to reduce oxygen demand and report it to the nurse immediately. Question 40. Residents' right to practice religious beliefs. Family is responsible. Employees must share beliefs. Employees must reassure dying with their own beliefs. It is the resident's right to practice regardless of beliefs. All residents have a right to practice their own religion, and caregivers must support these choices regardless of their own beliefs. Question 41. Cultural awareness in a care facility is not always practical, must be part of staff training, is sometimes sacrificed for cost, is not practical in large facilities. To provide holistic, respectful care, cultural awareness must be integrated into the training of all staff. Question 42. If a family asks for time to pray, which is not acceptable, give privacy. Ask questions about the procedure first. Ask the family to leave for the schedule. Tell the family you will return. Interrupting a family's prayer to stick to a rigid schedule is disrespectful to the resident's spiritual needs. Question 43. Ways a CNA can help spiritual needs. Discouraging. Tell the resident you can't engage in beliefs. Sit and listen. Assist to find pastor. Positive response to prayer. Telling a resident you cannot engage shuts down the relationship and fails to support the resident's emotional or spiritual well-being. Question 44. Positive benefits of religion. Gain independence/separate from family. Meaning and comfort. Positive health outcomes. Coping with difficulties. Religion is generally about connection. Using it to separate from family is not a standard positive benefit. Question 45. Talking to residents about spirituality effects. Connectedness. Mental health. All of these. Physical health. Spiritual well-being is connected to a resident's overall mental, physical, and emotional health and the relationship they have with their caregiver. Question 46. Participation in religious activities does not include reducing isolation, increasing belonging, promoting social contact, giving the CNA a break. Participating in religious activities is for the resident's spiritual health, not as a time filler for staff. Question 47. Dealing with cultural diversity effectively. Talk slowly and loudly. Avoid interactions. Ask coworker to take over. Recognize and correct stereotyping. Recognizing one's own biases, stereotyping, is the first step toward providing culturally sensitive and effective care. Question 48. Positive way of dealing with cultural differences. Use keywords/gestures/aids. Choose a similar coworker. Assume cultural differences equals intellectual deficiency. Ask family to take over all care. Using simple language, gestures, and respect shows you are making an effort to communicate effectively despite cultural or linguistic barriers. Question 49. How is family important in cultural awareness? Spiritual beliefs affect care. Culture affects expectations of caregiver. Culture affects gender roles. All of these. Culture influences every aspect of a person's life, including family dynamics, health expectations, and gender roles, all of which impact care. Question 50. Terminal illness, spiritual action for CNA. Share your own religious beliefs. Offer to contact a spiritual leader. Pray aloud for the patient. Avoid discussing it. The CNA should facilitate the resident's wishes. Contacting a leader the resident respects is the most supportive and professional action. Question 51. Implication of diversity in healthcare workforce. Job roles change. Team must work cohesively despite beliefs. Easier to work together. Little effect. A diverse team requires mutual respect and communication to ensure that different cultural backgrounds do not impede clinical cooperation. Question 52. Best way to honor personal space. Explain care/procedures and respect boundaries. Only talk when alone. Have family provide care. Explain everything loudly. Respecting physical and emotional boundaries by communicating clearly is the best way to honor a resident's personal space. Question 53. Effective communication with diverse patients. Physical distance. Learning all about the culture. Higher volume. Effective communication. Regardless of culture, the core of good care is effective, respectful communication that ensures the resident understands what is happening. Question 54. Basic way to provide emotional/spiritual care. Ask if they need family. Ask if they have questions. Ask if they need a counselor. Ask if they are eating enough. Giving the resident the opportunity to ask questions or express fears is a foundational way to build a supportive relationship. Question 55. Japanese man wincing during stocking application. Assume he's not in pain. Acknowledge pain and ask about current level. Tell the nurse he needs meds. Tell the patient he was brave. Acknowledge the resident's nonverbal cues. Asking "Are you in pain?" is a professional, caring way to assess their needs. Question 56. Psychosocial needs refer to. Does not mean anything. Physical and intellectual. Emotional well-being only. Emotional and recreational. Psychosocial needs involve the complex interaction between a person's emotional state, social needs, and recreational life. Question 57. Least significant reason aging is difficult. Loss of spouse. Impact of career choice. Dependency on meds. Requiring help with ADLS. An older adult is rarely worried about their career choice, they are more concerned with their health, independence, and loss of loved ones. Question 58. Western cultural view of health/wellness, caused by biology/medical sources, herbal remedies, supernatural/magical causes. Responsibility lies with the group. Western medicine typically views illness as a physiological or biological failure that can be diagnosed and treated by medical professionals. Question 59. Spiritual distress means regret choices, loss of hope, not sure of religion, not believing in God. Spiritual distress is characterized by a loss of hope, meaning, or connection, often experienced when facing terminal illness or transition. Question 60. Transferring stroke resident with weak side. In back of resident. On unaffected side. In front of resident. On affected side. Standing on the affected side provides stability if the weak leg gives way, while the NA supports the resident during the move. Question 61. When performing care activities, gloves should be worn. When feeding, when ambulating, when performing pericare, when changing clothes. Pericare involves potential contact with feces or urine, which are high risk for transmitting infection. Question 62. Task, stat means as soon as possible, before shift ends, out of scope, immediately. Stat is a medical order that signifies an emergency requiring immediate action to preserve the resident's safety. Question 63. Refusing a task, not assigned to shift, don't feel it needs to be done, already done it. Task should not be done by a nursing assistant. You have a legal obligation to refuse any task that falls outside the CNA's scope of practice, regardless of who requests it. Question 64. Alcohol impaired colleague. Tell the nurse in charge. Tell the NA to go home. Suggest AA, get coffee to sober them up. An impaired staff member is a major safety risk. You must report this to the nurse in charge immediately for the sake of the residents' lives. Question 65. Standard unit of measure for fluid. Meters, milliliters, milligrams, ounces. INO records are standardized to milliliters, ml, to ensure accuracy across all nursing documentation. Question 66. Resident having difficulty breathing. Notify the nurse immediately. Call family. Check back in a few minutes. Wait and see. Respiratory distress is an emergency. The nurse must be notified immediately for clinical intervention. Question 67. Member responsible for socialization/resources. LPN. Social worker. Physician. Chaplain. The social worker is trained to assess a resident's psychosocial needs and coordinate the resources to help them meet those needs. Question 68. Incorrect reference to cleaning urinary bag. Wash hands before/after. Use peroxide. Keep bag below bladder. Avoid touching tube ends. Peroxide can be damaging to materials and is not a standard cleanser. Follow facility policy for cleaning supplies. Question 69. Large spill on floor. Ask resident to walk away. Don't let residents leave rooms. Ask resident to stop traffic. Block off the area. Blocking the area is the only way to ensure no one accidentally walks through a spill and slips before it can be cleaned. Question 70. Walking in on resident having a seizure. Support head and move objects. Call doctor. Padded tongue blade. Restrain. Protect the head and remove surrounding furniture to prevent injury. Never restrain or put things in their mouth. Question 71. Immediate reporting condition. Increase in urinary output. Incontinence. Decrease in appetite. Difficulty breathing. Difficulty breathing, dyspnea, is an emergency that could lead to respiratory failure. Question 72. Conditions needing extra care for nail care. Anticoagulation therapy and diabetes, obesity and IBS, incontinence, dementia and insomnia. Anticoagulants increase bleeding risk, and diabetes impairs wound healing. Both require professional caution during nail care. Question 73. Advantage of being a CNA. Opportunity to practice many types of care roles. See several healthcare occupations. Practice many cultures. Practice as a nurse. Working as a CNA gives you an insider look at the entire healthcare team's functions, helping you decide your own career path. Question 74. Primary role of the CNA. Provide weekly assessments. Give family reports. Assist nurse with physical data. Give physical exams. The CNA's role is to collect and report the physical data that helps the nurse perform their assessments and medical duties. Question 75. Care plan true statement. All of these are true. Promises care will be delivered. Nurse faces penalties for not following. Is a legal document. The care plan is the foundation of legal documentation, care delivery, and accountability in nursing. Question 76. Accurate documentation assists the team. Crucial for determining intervention effectiveness. Is nice but rarely happens. Conversations are more important. Defends against problems. Documentation is the only way to track if a resident is actually improving or declining as a result of the provided care. Question 77. Healthcare team member responsible for medical plan. Registered nurse, doctor, every member, nursing assistant. The RN carries out the medical plan prescribed by the doctor and oversees the care delivered to the resident. Question 78. Reason for team approach in ambulation. Don't have to work as hard. More quickly. Explain while moving. Resident feels and is safer. Two-person assistance is often required for residents who have balance issues to ensure the resident doesn't fall. Question 79. Concern about assignment. Discuss privately with supervisor. Complain to coworker. Discuss immediately regardless of who's present. Tell the resident you can't care for them. Professionalism requires addressing concerns privately and directly with the supervisor, not involving residents or other staff. Question 80. Contributing factor to resentment of family. Missing family meals. Feeling of abandonment. Spiritual unrest. Missing birthdays. The emotional pain of being placed in a facility often manifests as a feeling of abandonment, which the resident may project onto the family. Question 81. Not an appropriate way to deal with stress. Exercise. Join new club. Talk to coworkers about patients during lunch. Learn something new. Venting about residents or sharing private patient information with coworkers during breaks is unprofessional and a violation of privacy. Question 82. Not a cause of constipation. Low fiber. Ignoring the urge. Increase in intestinal motility. Not drinking water. Constipation is typically caused by slow motility. Increased motility, as in diarrhea, is the opposite. Question 83. Sexual comment by resident. Humorous comment back. Let them know it is unacceptable. Walk away/pretend not to hear. Change subject. You must set clear, professional boundaries. Informing the resident that the comment is not acceptable is the correct response. Question 84. Encouraging participation in care. Improving sense of independence. Relieving burden on caregiver. Holding them accountable. Making them more mobile. Active participation restores the resident's dignity, sense of control, and mental outlook. Question 85. Ways to help with impending death. Sitting/listening. Spending more time than normal. Spending less time. Giving privacy. Avoiding a resident just because they are dying is neglectful. You should increase your support, not decrease it. Question 86. Pacing, yelling, swearing. First action. Call family. Tell to calm down. Apply restraints. Call charge nurse. A change in behavior should always be reported to the nurse immediately, as it may indicate pain or an underlying medical issue. Question 87. Not a normal biological change of aging. Ability to make decisions weakened. Joints stiffer. Digestive movement slower. Bones thinner. Aging does not typically weaken decision making. Confusion is usually due to disease processes, not normal aging. Question 88. Family member angry about resident's unhappiness. Tell her to leave. Listen and share concerns with nurse. Ask for complaint in writing. Tell her it's not your job. Validating the family member's concerns and escalating them to the nurse shows professional care and helps manage the relationship. Question 89. Dealing with anxiety. Speak in a calm voice/demeanor. Scream. Turn on TV. Open shades. A calm, soothing presence is the most effective way to help a resident who is unsettled or anxious. Question 90. Stages of grief. First stage. Depression. Denial. Anger. Acceptance. Kubler-Ross's first stage of grief is denial, a protective mechanism that helps people deal with the shock of a loss. Question 91. Change in mental condition. Ask resident if they noticed. Use humor. Report immediately to nurse. Spend extra time. Sudden mental status changes are medical red flags. Reporting them promptly is vital for the resident's health. Question 92. News of death, grief. Remind death is inevitable. Spend time and offer support. Change subject. Share own experience. Providing a calm, present ear is the best way to support a grieving person. Question 93. Frustrated, raising voice complaint. Offer support/comfort/calm manner. Ask to lower voice. Report incident. Walk away. Calmly de-escalating the situation shows respect and helps the resident feel heard and supported. Question 94. News of spouse death, grief. Humor. Bring residents in. Sit and offer support. Ignore/switch subject. Emotional support requires allowing the resident to process their grief, not distracting them from it. Question 95. Confused at dusk, sundowning. Alzheimer's, psychosis, dementia, sundowner's syndrome. Sundowner's syndrome is the specific name for the increased confusion and agitation that occurs as daylight fades. Question 96. Last sense to lose. Sight, hearing, taste, touch. Hearing is universally recognized as the last sense to fade before death. Always talk to the patient as if they can hear you. Question 97. Empathy definition. Feel pity, concern for pain, desire to help, ability to sense/understand feeling. Empathy is the capacity to recognize, understand, and share in the feelings of another. Question 98. Resident died and roommate is upset. Talk about your own loss. Talk with roommate/express feelings. Distract by changing subject. Remind them he's in a better place. Allowing the roommate to discuss their friend provides a safe space for them to process their loss. Question 99. Not a sign of depression. Decrease in appetite. Increased interest in social activities. Increased sleep. Withdrawal. Increased interest in activities is the opposite of depression, which is characterized by withdrawal and loss of interest. Question 100. Resident being restrained. Avoid patient. Check restraints every 15 minutes. Leave in charge of nurse. Call family. Safety checks, circulation, skin, and breathing every 15 minutes are mandatory when a resident is placed in restraints. Question 101. Ombudsman job. Set fees. Investigate abuse. Investigate breaches of confidentiality. Determine punishment for abuse. An ombudsman serves as an advocate for residents to ensure their rights are upheld, including the privacy of their medical records. Question 102. Included in Residents' Bill of Rights. Transport whenever. Social/recreational activities of choice. Family determines care plan. Informed about services and charges. The right to be fully informed about care, services, and associated charges is a standard resident right.